You want to finish what you started? You came to the right place. Them girls that you came with, you might have to part with. Depending on how this thing shakes. Wauwatosa, Kenosha, Milwaukee's in the house.
Hello, Wisconsin. It's Mike Gallagher. So, Wisconsin's initial distribution of the COVID-19 vaccines has quite honestly been a mess. According to the CDC, we ranked 10 out of 12 Midwestern states on administering a first dose per capita. Another analysis based on CDC data trackers had us ranked 46 out of 50 states in terms of distribution. That's quite frankly unacceptable. It's embarrassing. And it's especially puzzling because Wisconsin has one of, if not the best, healthcare systems in the country. And we have dedicated professionals that have been asked to go above and beyond in our hospital systems right now. So what explains this? Well, it's actually not a lack of supply from the federal government. That's what Governor Evers would like you to believe, but it is quite honestly a lie. Wisconsin has only used about 56.6% of the doses that have been delivered from the feds. Now, as demand increases, as we work out some of the distribution challenges, supply from the federal government will likely become an issue, but that really does not explain our poor early performance. And what does? Well, to answer that question, I think it's fair to look at the states that are doing much better than us. They're doing much better than the rest of the country, particularly the Dakotas and West Virginia, actually. And they're far from blaming the federal government. These states altered federal guidelines. They came up with their own unique distribution plans. They had much simpler criteria for who could get the vaccine. In West Virginia's case, they opted out of a federal program that relied on CVS and Walgreens to vaccinate nursing homes and instead relied upon their own local pharmacy networks instead. They leveraged the National Guard to do delivery. I mean, such is the beauty of federalism in our country. It tells us what works and what doesn't. And now in Wisconsin, we haven't worked as well. And I'm not just bringing that up to criticize Governor Evers, though I think his lack of leadership in this regard deserves a lot of justified criticism. But that's not the point. The point is we can actually fix this and save lives. So how do we do that? Well, I think the biggest problem, in contrast to those other states I talked about in Wisconsin, has been these complex subgroups and the different rigid phases where you can only get the vaccine if you work in a specific industry or if you're a mink farmer. And I think that's just created a lot of confusion as to who's eligible and how they might go and sign up. And it's classic government where something that seems very nifty on a spreadsheet actually becomes complicated when it meets reality. So I think going forward, we just have to keep it as simple as possible. Now, this week we've opened it up to everybody over the age of 65. That's something we should have started with, quite frankly. We need to get that message out there because we just need to get those needles out there in the arms of as many people as possible. And we need simple, direct, and repeated messaging so Wisconsinites understand who can get the vaccine and how they can get the vaccine. That's the first thing. The second is I think there needs to be more flexibility for vaccinators to actually keep their schedules full. In other words, while we rightfully prioritize appointments for those who are 65 and older, they're in the most vulnerable group, let's give vaccinators the flexibility to vaccinate those outside of this group if they have the resources and the time, right? They should have the flexibility to move on to the next subgroup, the 1B group, which actually doesn't go into effect until March 1st, because different areas of the state are going to move at much different paces going forward. And we don't want any idle vials sitting there just because one area of the state is waiting for the rest of the state to catch up, and therefore we can all move on to the next subgroup. We can't let the perfect be the enemy of the good. And honestly, we should have 24-hour vaccination sites going around the states, which leads me to my third and final point, which is what is the role of the federal government? Well, our hospitals have been asked to shoulder an additional burden here. And I do think the federal government owes them the resources that are necessary in order to vaccinate at a rapid pace above and beyond what they're already being asked to do. But really the federal government, well, beyond approving other vaccines once they're proven to be safe, particularly the Johnson & Johnson vaccine, which can be transformative because it's a single dose, I think the federal government's main job is not to come in over the states and tell them how to do distribution. It's really just to keep the supply coming in partnership with the private companies that are producing the vaccine. And I think our shared goal as Wisconsinites on the right and the left should be to get our state into the top 5 when it comes to the percentage of allocated vaccines that have actually been distributed. And when we get there, we will have a supply problem from the federal government. And Wisconsin will need more than 70,000 doses per week. And Governor Evers should be able to go at that point to President Biden and say, hey, Mr. President, Joe, I'm running low. We need more. We don't want that supply to run out. Which leads me to my final point. President Biden recently said there's nothing to do to affect the trajectory of the virus. I don't know if that was a misstatement, but if it wasn't, I think that is absolutely stunning, because it's not only a reversal of what he said for over a year on the campaign trail. It's not true. It's malarkey, to coin a phrase. I mean, this is what we can do to affect the trajectory of the virus, or at least the toll it takes on our own lives. Wisconsin can lead the way when it comes to vaccine distribution. We're not there yet, far from it, as these early stumbles have shown, but we can get there. Lives are hanging in the balance. And again, because we have one of the best hospital and healthcare systems in the country, I firmly believe if we figure a few basic things out, we can lead the country in vaccine distribution.
The